Hey guys, welcome back for our daily practice questions. As always, I like to do my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, review books, review courses, tools, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you if needed. I always like to give my disclaimer before getting into our practice questions for today that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see on here, I have designed and created based off of what is currently being tested on the ANCC as well as AAMP exam. Now, if you see any of my videos and I'm teaching you on what we currently do in practice, I will say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, so question number one states a patient presents to the office with complaints of hearing loss to the right ear. He states that he is not sure what has changed. Upon examination with the Weber and Rhine test, the nurse practitioner notes that BC is greater than AC, and when completing the Weber exam, the sound lateralized to the right ear. Based on these findings, how should the nurse practitioner diagnose? Is it A, sensory neural hearing loss, B, presbycusis, C, conductive hearing loss, or D, there's no diagnosis at this time? Have the patient follow up if the problem persists. Take a moment and tell me what you got in the comments. All right, you guys. So the stem of the question states, well, first, let me just say this. Y'all know I always recommend reading the stem of the question first, right? Stem of the question being that last sentence typically of the question, the one with the question mark, to slow yourself down and allow you to ensure that you're answering what's even being asked. We rush through, we skim through, just stop and start with the stem of the question. So here the stem of the question states, based on these findings, how should the nurse practitioner diagnose? Y'all know what I say. If they're asking you for a diagnosis, you got to run it back and see what the assessment is. How did they present? So if they're talking about assessment and any other questions, or as you're studying or you're trying to figure out what to strengthen, assessment is the presentation. What assessment did you do? How did they come in? What were their signs and symptoms? So that's the subjective findings, right? What did you observe? That's the objective findings. What did you do to assess and formulate these things to come with your differential diagnoses, right? So whenever I say run it back and look at that, that's what I'm referring to. Whatever this if they're asking for the diagnosis, you got to run it back and look at all these things, right? So the patient came in complaining of hearing loss to the right ear, right? That's the subjective. That's what they're telling you is wrong. And so the nurse practitioner is doing their workup. He's not sure what's changed, so nothing has caused this that he is aware of. The nurse practitioner does the Weber and Rhine, right? And, I say visualize this patient in front of you. And so the nurse did the Weber and Rhine. BC is greater than AC, so bone conduction is greater than ear conduction. So in your mind, you should note that's abnormal, right? So we'll just hold on to that. And then when doing the Weber exam, the sound lateralized to the right ear. That's also an abnormal finding, right? Because with the Weber exam, you should hear the sound equally in both ears. It shouldn't lateralize to either ear, right? And then with the Rhine, AC should be greater than BC. So air conduction should be greater than bone conduction. Here it says bone conduction is greater than air conduction, right? And then it says the sound lateralizes to the right ear. So the affected ear, the ear he's complaining about. So the best answer is C, conductive hearing loss. So let me walk you through it why. Because I get a lot of questions on this, and in every one-on-one session that I do, when we go through EENT and we talk about hearing loss of Weber and Rhine, there's always some mix up, but we work through it and get it understood. So I like to keep this going through the questions to kind of just be a refresher for you guys. So when you think of it, I say take it step by step. Don't try to look at all the pieces and then just come up with something. Slow yourself down and walk through what they're saying. Picture the patient, visualize them in front of you. So you have a patient in front of you. Male comes in, hey, I'm having hearing loss in my right ear. I don't know what's going on, but it's changed in my right ear. So instantly, as their provider, you're thinking, all right, let me run through the test to kind of rule some things out and see what we have going on. So you're doing your Weber and your Rhine with your tuning fork, right? Strike that tuning fork to do the Rhine exam, place it on that mastoid bone. When they can no longer hear it, place it in front of the ear, right? You want it to have air conduction greater than bone conduction. If the bone conduction is greater than air conduction, is abnormal, which it is here. All right, so let's go a little bit further to get a little more confirmation to see what type of hearing loss we're dealing with. So we do the Weber exam, we strike that tuning fork, place it on the middle, the center of the forehead, and you ask them, hey, do you hear the sound equally in both ears? No, I hear it more in the right ear. All right, so the sound lateralizes to the right. That's what's going on here. That's abnormal, right? But the right ear is the ear he is complaining about, the affected ear, right? If the sound lateralizes to the affected ear, it is conductive hearing loss, right? Something is blocking that sound conduction, causing a conductive hearing loss. So either cerumen, something is in the ear, whatever, something is there blocking it. Whereas if the sound lateralizes to the unaffected ear, so if he would have said the left ear, the one he's not even complaining about, then it would have been sensory neural hearing loss, right? So something like presbycusis or Meniere's disease and things of that nature, it's a neurologic issue, not a surface level, something is blocking it right here issue. That's why it's lateralizing to a totally different side than he's even complaining of, okay? So here, the best answer is C, conductive hearing loss. Bone conduction was greater than air conduction, and it lateralized to the affected ear here. Okay. If you struggle with this, go check out my Weber and Ride videos to kind of walk you through. Okay. All right, question number 2. A patient presents to the office with complaints of fatigue. The nurse practitioner notes a beefy red tongue on exam. As the nurse practitioner reviews the patient's lab, hemoglobin and hematocrit are low, MCV is 120, and MCHC is 34. What is the best diagnosis by the nurse practitioner at this time? Is it A, iron deficiency anemia, B, folate deficiency anemia, C, thalassemia, or D, B12 deficiency anemia? Take a moment and tell me what you got in the comments. All right, you guys. So, stem of the question states, what is the best diagnosis by the nurse practitioner at this time? Again, what is the diagnosis? You need to run it back and tell me what assessment findings we have. So, the patient came in, they're complaining of fatigue. The nurse practitioner notes a beefy red tongue on exam. We want to pause here. You should already start to form differential diagnoses in your mind. When there are key identifiers in a question, go ahead and start thinking that. You know my thing. When I say this, you say that, right? So when I say beefy red tongue, what do you say? Tell me in the comments. When I say beefy red tongue, you say what? You should be saying B12 deficiency anemia, right? That is a classic key identifier, but just hold that. So we're holding that in our mind as a differential diagnosis. We're looking over here. We're like, oh, okay, yes, that's actually an answer choice. Let's confirm it, right? So the nurse practitioner reviews the patient's lab, the hemoglobin, hematocrit low, okay, anemia, and the fatigue. Okay, it's making sense. The storyline is making sense, right? All right, so MCB is 120. All right, let's slow down. Let's think. Wait a minute. You're thinking of the labs in your head. MCB should be anywhere from 80 to 100, right? If it's less than 80, it's microcytic. If it's greater than 100, it's macrocytic. It's 120, so it's greater than 100. So here we have macrocytic, right? And then the MCHC is anywhere from 31 to 37. If it's less than 31, it is hypochromic. If it's greater than 37, it is hyperchromic. If it falls in between, it's normochromic, right? So 34 is in the normal range, so it's normochromic. So, all right, what do we have here? Patient came in with fatigue. We see a beefy red tongue. We're starting to think B12 deficiency anemia. Lab values showing he is anemic. MCV macrocytic, MCHC normochromic. That confirms your diagnosis of B12 deficiency anemia. Then you know that I always say with my 2-1-2 rule for anemia, if you don't know it, go look at my anemia video to help you tie it together. But with my 2-1-2 rule, I say there's two that fall out of the 5 common anemias. There's two that fall in that small range of microcytic hypochromic, right? That's your thalassemia and your IDA. We know we're not dealing with that, so you can eliminate A and C. There's one that falls in the normocytic normochromic range, which is the anemia of chronic disease. We're not, we don't have that here. So we don't even have to worry about that. And then there's two that are in the larger range, which is the macrocytic normochromic, right? And that's your folate deficiency anemia and your B12 deficiency anemia, right? So with that, we try to figure out how you differentiate between the two. B12 deficiency anemia uh, typically has the neural symptoms, and beefy red tongue are things that are clear classic presentation. Folate does not. So this further confirms your thoughts of your differential of it being B12 deficiency anemia. The answer is D. And I wanted to spend a little bit of time with that because two of my one-on-one sessions this week, they were still struggling on fine-tuning anemia. So I just want to throw it back out here to kind of make sure y'all are following me and kind of help y'all get that under control and narrowed down. All right, and question number 3. Upon examination, the nurse practitioner notes a systolic murmur at the apex of the heart. What type of murmur should the nurse practitioner diagnose? Is it A, mitral stenosis, B, aortic stenosis, C, mitral regurgitation, or D, aortic regurgitation? Take a moment and tell me what you got in the comments. All right, so stem of the question states, what type of murmur should the nurse practitioner diagnose? So, all right, let's run it back and see what we have. So, the nurse practitioner notes a systolic murmur. So, I always tell you, make sure you know systolic versus diastolic and then the location, okay? So, first, it's already telling you it's a systolic murmur. It'll always tell you one versus the other. So, what are your systolic murmurs? And there are so many mnemonics out there. So, whatever mnemonic you know, stick with it and narrow it down, right? But if you struggle with it, Brittany's Brilliance, my mnemonic, I say for murmurs, for systolic, I call it sassy systolic. Sassy systolic says men really are stupid. So men really, MR being mitral regurgitation, are stupid, AS, aortic stenosis, right? So we know we can narrow this down to C and B because they're systolic murmurs. Go ahead and mark out A and D, right? So B or C is our answer choices. Now it says at the apex of the heart. So lower down, right, at the apex of the heart is the mitral location because at the base of the heart is aortic, right? So your answer choice is what? C, mitral regurgitation, right? Because we're at the mitral location and we're dealing with a systolic murmur. Mitral regurg is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. If you need any resources from the Nurses Studio, just give us a call at 803 400 6864. You can also shoot a text to this number or shoot us an email at thenursinstudio, the number one, at gmail.com. If you're wondering what we offer review books, either in an ebook option or you can have the paperback shipped to you. It is broken down by systems with colored images to help you with your studying. There's an interactive section that is fill in the blank that after you have reviewed the short and sweet review style, then you can test your knowledge in the format of how I teach assessment, diagnosis, evaluation, treatment. There's also a mini medication area that just kind of recaps over the pharmacology that goes along with that system. And then at the end of the book, there is 175 practice questions with rationales for you to review. Okay. You can get that in ebook or paperback. Both are linked in the bio of this channel. Now, the ebook, of course, once purchased, is on any of your devices. So you can easily access it and study on the go. Pick that book, will be shipped to you, and then you can review on the go as well. Now, for its review courses, we have a self-paced review course designed for FNP and adult general reviewers who are preparing for the AANP or ANCC. It's broken down by systems. There are videos teaching that you can watch over and over in a systematic approach, along with mini quizzes associated with each. Um, and it's on a subscription basis. This is also linked in the bio of this channel. We have a 5-week intensive review course that starts on June the 10th. That's our next one through July 19th. It is again a 5-week review. What we do Monday through Friday, you will be provided uh, many assignments to work on. You'll get videos with me teaching and instructing you. You can look and do these on your schedule. Some people choose to do it because it's released every Sunday for that week. Some people choose to, based off of their work schedule or whatever, just life schedule, to submit everything at once. Some people do each assignment a little bit each day, but Monday through Friday is how you can work on it. And then on the weekends, we don't have any assignments because I allow that time for you to build and work through any of the things that you want to revisit and review. But we do live practice questions once a week as well as a group. And if you don't, if you're not able to make that time frame, then the replay is available. And we do that each week throughout. Then the last week is the individualized week because you know how it goes. Sometimes you take a review course and you're like, yeah, I got it. It was good. It was nice, but I don't know where I am. I don't know if I'm ready. Well, that's what that last week is for. Really to meet with me. We have a session. I'm following you the entire 5 weeks based off of your assignments, based off of the feedback, based off of the live. And then I do, I give you that assessment of your strengths and weaknesses, and we gauge where you are during that session. And I give you advice on new steps if it's something that you need to work on, if you want to set up things so that I can help you tie it all together. That's what that individualized week is for. So that's the 5-week review, and we actually have one more spot available for that upcoming June one. And then lastly, we offer one-on-one sessions that are, I always say, give us a call or shoot us an email because they are customized for you. So during that one-on-one session, we're able to really maximize what you need. So some people just say, look, I struggle with asthma and COPD, and they want to spend a one-on-one session with me just helping you get that from a weakness to a strength. And then there's some people who need a custom package. You need a full plan of everything. More commonly, it's like, hey, I was unsuccessful a few months ago, been studying, but I really just don't know, where to restart, what to do differently. So with this, I gauge where you are. I review your previous test. I give you pre-test. I assess your weaknesses and then structure a study plan for you based off of the timeline that you want to allot and review. And then we work together during that time frame. We meet throughout as well, and then I help you to go from being unsuccessful to successful. So that's why I say just call in or shoot us an email so that we can gauge your needs and design and structure that one-on-one plan for you. So if you are interested in any of those things or need any of those tools, just give us a call or shoot us an email. Look forward to working with you guys. But as always, make sure y'all meet me back here. Happy studying. Bye, y'all.